Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss some tips and techniques you can use when it becomes too painful to exercise after your knee replacement surgery. So this is something I hear both for individuals who are prior to surgery and have knee pain and arthritis, and also for individuals after knee replacement surgery as well, is that you just have so much pain and stiffness and discomfort in your knee that it's just very painful when you're exercising or doing any type of activity. So that when your physical therapist or your doctor or someone says, you need to get some exercise, it's important to exercise, do your exercise, and you just look at them and say, well, it's way too painful. How could I possibly do that? I can't even tolerate and handle that. So let's talk about some tips and techniques if you're someone who is described by what I was just saying. So the first thing I want to talk about is it's okay to have some pain. So it's okay to try to work through some pain and discomfort to an extent. I tell people, if you're in that range of a little bit minor pain to almost kind of working up to moderate intensity pain, it's okay to work through that pain. You're not going to cause any harm, you're not going to cause any increased damage or injury to your knee or any really other body parts or soft tissue around the knee. When you start to work up past that moderate intensity and get to that really high significant pain and discomfort, same thing, you're not necessarily going to cause any injury, but what you can cause is a flare-up of symptoms and pain and discomfort and swelling and stiffness that could really set you back even more, and you're not going to be able to tolerate exercises the next day or the few days after that. So first thing to know is it's perfectly okay to have some pain and to work through that pain a little bit. It's not causing any damage or injury or harm to anything. Now, some other things to keep in mind is if the pain is to the point where it's really not tolerable and intolerable to exercise or do any activity, is one thing you can do is plan ahead. And what I mean by this is think of some strategies that can help decrease your pain, calm down your symptoms as much as possible before you're going to exercise. So this may be timing of your pain medicine, so taking it a little bit before you know you're going to have physical therapy or exercise or activity. It can be using techniques such as heat or ice to the knee or around the knee. It could be doing some massage to the muscles and soft tissue around the knee and in the leg to calm things down, loosen things up so that you can tolerate the exercise and activity a little bit better. Or it could be something like electrical stimulation or putting a TENS unit on your knee either prior to doing some exercise or activity or even during that activity as well. Another thing you can do is try your best to adjust the exercises and activities you're doing. So there's a lot of different ways that you can kind of modify and change what you're doing to hopefully be able to do some activity with little pain or pain that is tolerable. So for example, if you're doing an exercise and using some sort of resistance, either with weights or bands or whatever that may be, try bringing that resistance down, either decreasing it or taking that resistance completely away. Being able to just go through that movement, even without the resistance, can still have some benefits. What you can also try is changing how much of the range that you're doing the movement in. So for example, if you're doing a body weight squat, instead of trying to go all the way down to getting the knees at 90 degrees parallel, try to squat a quarter of a way or a half of the way down and see if that's tolerable and you're able to do that. Same thing with any other type of movement. Try doing half of the range or a quarter of the range and seeing if that is tolerable as well. Another thing you can try is focusing on a different body part or a different exercise. So for example, if you're having a lot of pain and difficulty with doing your range of motion exercises for your knee, maybe take some time to focus on an exercise that focuses on strengthening your hip muscles or strengthening your calf and your feet and ankle muscles. Focus on a body part that is nearby, so the hip or the ankle, and not necessarily that specific part. And hopefully that will give you some benefits and decrease some of that sensitivity, decrease some of that discomfort. So either the next day or within a few days or a week, you're able to start to tolerate the exercises specific to that body part a little bit better. Some other things you can try is changing the position. So maybe doing certain thing or certain movement on your back is really uncomfortable and painful, but if you try a similar thing in a seated position, maybe that's a little bit easier, or vice versa. Or same thing, something that you try standing up is really uncomfortable, but you try lying down and doing it, it might be a little bit more tolerable. Some other things to keep in mind is trying to incorporate exercises or activities that are low stress and low impact on your knees and your legs. So things like bicycling or cycling, things like using an elliptical machine, swimming, all great options to still get some exercise, still get some movement, but a little less stress and impact through the knee joint, oftentimes a little bit more tolerable for folks before or after knee replacement surgery. And I can't end this video with saying that aquatic therapy or pool therapy or pool exercise is a really, really great option out there. It really can take a lot of that load and pressure off of the knee joint and allow you to do all sorts of different movements, work on your range of motion, do strengthening, do walking, do all sorts of really helpful, beneficial activities and movements. And I find that people really tend to tolerate aquatic therapy really, really well, especially if you're someone who is having a lot of pain and discomfort and not tolerating the land-based exercise as much. Aquatic therapy is something that I really recommend looking into. So just understand, if you're someone who has this pain with your exercises and physical therapy, that a little bit is better than nothing at all. So if you can make these adjustments or modifications or changes, at least temporarily, and still do some sort of exercise, some sort of movements, you're really going to have a lot more benefit than just saying the heck with it and doing nothing at all. So keep that in mind as well. Thank you very much for watching. Please be sure to hit that subscribe button, turn on the notifications if you're interested in all things knee replacement surgery, frequently asked questions, exercises, recovery, everything else in between. Leave your comments and questions below as I do my best to get back to every comment I see, and thank you very much for watching.